Good day, everyone. Lovely to be here with you. I'm Connie Harmsen. I'm Senior Vice President and Chief Clinical Information Officer for Health Next. We're happy to be here with you today to be able to present to you our digital advisory service line that Will Conaway will be doing. And then we're going to be talking about our case study, AltaMed Health Services with Lowe. So just to give you a little bit of background in regards to myself. I have 20 years nursing experience, started as a critical care nurse, became a chief nursing officer, and then also worked as a chief executive officer and chief operating officer in a number of healthcare systems here in the US, including Banner Health and Presbyterian in Albuquerque, New Mexico. I also have some international healthcare experience and served for several years as the eHealth Program Director in Australia at St. Stephen's Hervey Bay, part of Uniting Care Health. That was the brand new hospital that came up and had a full EMR suite, the first in the country when it opened in 2014. And it became the first HIMSS Stage 6 and 7 certified organization. And we also won the Innovation Award for the Asia Pacific region. It was a wonderful opportunity to be there and get some great Aussie spirit as well. I then went on and was the Managing Director for the Asia Pacific region for HCI, until then returning back to the US last year when COVID hit. And now, as I said, very happy to be here in this role as, with Health Next, which is our whole new virtual healthcare program. Will, I'm going to turn it to you now, if you'd like to introduce yourself, and then you'll go into the digital advisory service line. And if you would, Josen, if you could just go down to the slide that has Will's picture and then into his slides, that'd be great.
Thank you.
Very good.
I appreciate that, Connie. I'm Will Conaway. I'm the Vice President of Provider Delivery for the HCI Group. I know that's kind of an odd title. What is provider delivery? Vice President of all things. What I do for HCI is I oversee growth and strategy. I'm responsible for several of our mega accounts on their day-to-day operations around the clinicals and the financials and even the non-clinical. I provide oversight and guidance and business direction on our field services, build operations, infrastructure, databases, unified communications, and such. Also, I'm responsible for disseminating information around emerging technologies, not only to our organization, but to our clients. And then I oversee some contract reviews such as KPIs, SLAs, and OKRs. So you can see we got quite a few acronyms flying today, and OKRs become one of my new favorites with objectives and key results. But what I'm here to talk about today is creating roadmaps for digital transformation for our clients and what strategy next looks like. So I'll be hitting into that a little bit more on my background. I have a little bit of a diverse background. I've had executive leadership roles in the automotive, the consulting, and the healthcare industries. My work has always been a blend of operations, technology, and strategy, where I'm going to be talking about today. I've been fortunate enough to work for 3 of the largest healthcare organizations
1, 2, 3, 4
in the United States. Can you guys hear me?
We can hear you. Yes, we can.
Okay.
Yes.
I'm fortunate enough to work for 3 of the largest healthcare organizations in the United States around Providence Health, Dignity Health, and Prime Healthcare. In addition to that, I teach at Cornell University, where I like to say I teach to some of the finest master level students in the world in the psychology of leadership, decision-making, negotiations, and of course, strategy, one of my favorite topics. I've been very fortunate over the years to Cornell to work a lot of private courses and to work a lot of just work about strategy with organizations, and those organizations, some being IBM, Accor, Sylvania, JP Morgan, Marriott, and Amazon. I'm also part of the Forbes Technology Council. I'm on the Chimes AEHIT Advisory, former chair of Kansas State University Psychology Association, was on the executive leadership team at the American Heart Association in 2020 for the Los Angeles, but on Los Angeles World Affairs Council, and have written some articles for Forbes. I've also been on the Consumer Advisory Council of AT&T, Verizon, and Manifest, and I served on the Board of Governors at the Federation of American Hospitals in 2019. I've been fortunate enough over the years to win a few awards around being the 2020 recipient of the Constellation Business Transformation Award, and won Becker's Hospital's 100 Hospitals System CIOs to Know for 2019. I've been fortunate enough to write a few articles and talk about strategy. Articles been in American Healthcare Leader, Health Tech Magazine, Becker's Healthcare Review, Forbes, Gigabyte, Business Chief, and Global Healthcare Magazine. So what long-winded talk about myself there, but just a little in the background of the strategy that I've done. So if we can move down to the slide, I believe it'll be number 6, where it says HCI on it. It has a nice little photo of the world and some logos on there. We could. A little about HCI. And for those of you who know HCI, it is not the same organization that we had 10 years ago. HCI, and what I've put up there in the quote marks, is our mission overall. And that is your partner in advancing health and well-being through digital transformation and solutions. So the HCI group is a global leader in healthcare digital transformation. You know, HCI is really committed to improving healthcare globally through a combination of what I call disruptive innovation, design thinking, cost optimization, and we have a really broad scope of digital transformation solutions. And we do all this work in nearly 20 countries, that being, you know, North America, Europe, the Middle East, and the Asia Pacific. So as we can see there, we're teamed tightly with some very wonderful healthcare organizations, also a big part of Chime, HIMSS, Blackboard, where we won a tremendous award. And you'll see we even have some high scores in class. So very tough organization around knowing our strategies and being able to really get things done. So if we can slide to that next slide down there, where it says Introduction to Strategy Next. And the reason I'm showing the different mission, vision, and values is I think it's important as people look for an organization that they would consider doing business with, that each one of these service lines has its own mission, vision, and values. And as you can see, our mission is accelerating customer health digital transformation. And we're very clear about that. We have a vision of being the trusted advisor in healthcare digital transformation. But I think our values are something that you should be able to really grab a hold of and have a good value and understand things. I mean, commitment to customer, everybody wants to know about that. Heavy into diversity.
Will, just excuse me for 1 minute. Johnson, could you go ahead and please advance the slide for Will? Are you able to advance the slide, Josen?
Yeah, it should say Introduction to Strategy Next on it.
Yes,
there we are.
It does.
There we go. Thank you. And then when we look at these values, I think another important one is hyper-customization. And that is we work with the...
Oh my God, that's funny. Sticky fingers.
Josen, excuse me, do you want to mute your audio, please?
Yeah, I apologize.
Yeah, and we talk about hyper-customization. We're really working with organizations and groups to make sure that the work we do really pinpoints into the items that they find of value and what adds value to their customer. Also, we talk about quality and creativity and innovation are all items that are very important to us. So if we can slide on to the next, or move on to the next slide, you'll see a picture of a gentleman there named Ed Marks. And I was asked the other day, am I doing this alone? By no means am I doing this alone. This is a very large project and a very well-developed service line. I've been very, very lucky over these last year here to be working with Ed and great people like Connie. But Ed is a person who's co-leading this with me. Ed is our Chief Digital Officer for the HCI group. Ed's one of the country's leading experts on digital transformation. He's a former Cleveland Clinic CIO. He's been on the CIO for the advisory board. And Ed's probably best known here in the last few years for a couple books that he's written on IT and the topic of transformation, and that being Voices of Innovation and Healthcare Digital Transformation, and how consumerism, technology, and the pandemic are accelerating the future. Besides Ed and myself, we have some great leadership around who can really help and really understands healthcare from a deep level. We have people who have been a former CEO of a healthcare organization. We have a current CMO who works with us. We're really providing things in that deep way. And we also have a new person on board here on our team who is just outstanding, a younger person who really has, the understanding of digital transformation, great foothold onto telehealth, remote patient monitoring, and really can rounds out our team very well. We have a very large team of very experienced people. So if we can move on to the next slide, and we talk about here with
Will,
yes,
there we are. And because we are behind in slides, and dear audience, apologies to you. Part of our technical challenge we're having is Will cannot see the slides. So he is doing it without being able to actually visualize them with just some of the things, as we all know, happen in our wonderful technical world. So Josen, this is the one that is in regards to Ed Marks that he was just speaking to. So please go on to the next slide then, if you would, Josen.
Yes, ma'am, that has been advanced.
There we go. And let's talk about the senior technology healthcare concerns. And when you look at this, I would actually, when you say senior technology, I would say healthcare, senior healthcare leadership concerns that people have. And I always like to tell this kind of fun story, but things have changed greatly in healthcare over the last few years. And I will say over the last 10 years, it's almost a different job. And when I think about this years ago, when I was first getting into being able to go to the board meetings and such, and we were talking about where technology fits in, I was usually the guy with the rest of the people in IT, the executives, who would sit in the back and be the person who passed out the cookies and sandwiches as people came in, because people really weren't that concerned about what people in healthcare IT had to say. That has totally changed. Today, when you start looking at things besides labor in healthcare, the most expensive item you're probably spending on is your technology. And it's also probably the single point of service or department that touches every part of the patient's experience, from the time they're thinking about where they're going to go, all the time to when they're discharged and go back home. And even after that, there's always some type of technology involved. If we can go to the next slide, it's going to be a blue slide. It's going to say from Becker's Hospital Review. And
it's actually the next one, Josen. There you are. Very good.
And when I talk about these type of things, and when I talk about the rules, how technology has changed, the expectations that the board has put on people in healthcare is really night and day from where it once was. There's a lot of pressure put on to generate revenue, to do things better, to really be part of that executive team. And the other thing, when we talk about how things are evolving within healthcare, I would say that when people ask me, hey, why do I need a strategy? Why do I need to worry about these things? The next 3 years will come one way or the other. I would say that's not the case. Actually, if you don't have things put together, if you're not looking at things in the next 12, 24, 36 and on, your next job in the next 3 years will be looking for a new job, not worried about things. So let's move on to the next slide, where it says digital transformation topics in the minds of senior executives. And this is people in healthcare overall. And I'm not going to go through all of these 15 boxes, but there's a couple boxes that I think everybody's kind of concerned about at this point and wondering about. When we start looking at those transformation items, telehealth and remote patient monitoring is a huge item. If you were just to look at the year 2020, and if you were just to look at 20% of all medical visits in the US being, virtual, that number would add up to about $29 billion. That's with a B. That's a ton of money. And so there's a lot of concern around how we make this work. Things are changing and how people see how they're going to get their health care. The consumer's really driving things. One other item on here that I think is of key importance, and that is around privacy and security. And it's interesting when I see numbers like this one. You always know that it's done for a little bit of fact. It wasn't 60, it wasn't 80, it's 92. And 92 healthcare ransomware attacks occurred in healthcare in 2020. And that's about affecting 600 separate hospitals, clinics, and healthcare facilities. So pretty large effect. And if you're wondering what that looks like, that's about 18 million patient files that could be compromised. So things around security are big. Other things we look at that people are going to continue to be worried about is around consumerism driving technology. What are you doing with that consumerism? Do you understand how you're addressing and ensuring that the customers' interactions and outcomes are easy, convenient, and timely, and streamlined to their lifestyle and what they need? We look around cloud. Do you want to be on-prem? Do you want to multi-cloud? A lot of companies ask me about, hey, what companies like Amazon, Walmart, CVS, what are they all doing in healthcare? How's that going to affect me? These are all things we're going to look into. And, we can even help you on the things around, rules and regulations and their dates and what that might mean to you. You know, you're still looking at a lot of items on here, IoT, lots of products out there right now, lots of hot products, just in general in there. I mean, we have products like Health Next, which is really transforming healthcare delivery. Wearables are becoming a big item they put in there. And then you ask yourself, what are you doing around business process automation and robotic process automation? All things that people are asking about, and all things that need to be put into a strategy. So if we can move into this next slide, and it's going to start out with a digital roadmap as an approach. This is a very high level definition of how things are, but I think it's a little too simplistic. And the reason I say that is, for those out there who are wondering, everybody's digital transformation definition is going to be a shade different in healthcare. And it depends on what your organization's maturity level is and what you need. So from a high level, you know, digital transformation integrates digital technologies. We talk about that. You know, digital technologies are the electric tools, systems, devices, resources that generate and store and process data. But that is just part of it. The key to digital transformation is that it influences all areas of a business or organization. And by doing this, and I say this, digital transformation, it fundamentally changes how an organization delivers value to its patients. For those organizations that are somewhat along the road and doing well at this, this is a cultural change that they will tell you about. For most organizations, they're going to tell you that this is a paradigm shift in how they do things, and they're going to need help. They're going to need that digital strategy and how they're going to get there for their transformation. You know, companies and organizations, no matter what's the industry, and you know, continue to fall into two buckets. I would say with healthcare, that bucket is very skewed to one end, and that being those with not a lot of experience. You know, there's those companies that have a lot of time and resources in digital innovation. You know, they've hired their chief digital officer. They're well along the way, and they have somewhat of a you know, North Star on where they're going. But that's really the exception. For most people, they'll tell me they have a little bit of automation here and there in healthcare. And I have to remind people that saying, you know, you're using the newest version of Smart Sheets, that doesn't count. We're looking for somebody who really has different strategic initiatives and, you know, a digital charter and a CDO in place. Those are the things we look for, and most organizations can't do that. The other thing is that we find is that most organizations don't even have a single owner for their digital strategies and transformation as they move. You know, sometimes it's IT that owns it, sometimes it's an executive team, and sometimes it's just a hodgepodge of, you know, many groups of people who are all trying to be part of something. So we can form that for you, we can help that with you, and we can work through it. So if we can move on to the next slide, where it says reasons why healthcare organizations need a digital strategy. There's a ton of reasons here, and I'll hit a few of them. The first is you really need to have a good understanding of an in-depth business discovery. And that is, do you know what you're doing? Have you done things in a way where your IT strategies all roll up into the holistic overall reaching strategy of an organization? That is key, that you have to be part of it and congruent with the mission and the values that are going on within your organization. The other thing is we need to ask ourselves, how do we reach our audience? You know, are they online? Where are they finding us? How are we helping them? And then we talk about things like getting track and ROI and getting everybody on the same page. We can help you put those metrics together. And I often find companies and organizations that are struggling with this, they try to measure what makes them look good and what doesn't. You know, looking good is one thing. You want to measure the things that make you better. So we're looking toward driving that. And then the other thing is we want to make sure you're not missing any opportunities. And, you know, we're going to look at things like consumerism. Where's that? You know, delivering system transformation, data and analytics, interoperability. Is anybody ready for EHR 2.0 as we talk? Those type of things, holistic health, next generation payment methods, even looking at, you know, things around 3D printing, maybe someone wants to talk about it, they want to get into that. And of course, something that's changed drastically in the last couple of years that we didn't see in the past, and that is around mergers and acquisitions, private equity, those type of things that people are asking me for and wanting to know more. How do we roll that in there? But also, I will go back and say, we also want to make sure we're hitting the good blocking and tackling things too as we look at this. And that is, what are you doing around your EHR? You design, build, and test. Do you have enduring and virtual training put in place, EHR selection possibly, applications, app rationalization, population health, automation back to BPA, RPA, analytics. I mean, do you have a data warehouse with lakes, or have you created a swamp where you can't find things? Around infrastructure, we're looking at interoperability. I mean, are you able to do API? Most are. I think everybody is. HL7, how about fire? Are you able to go to that next thing? You know, cloud transformation. All of these items add up into your overreaching strategy that really define who you are and help you define the brand of your company. So just a couple more slides here. And how do we get you to digital transformation? And let's move on to the slide past that where it says, what are strategy next services? And really what we're looking at here, and I'm not going to read this slide to you, but what we're doing is we're getting in there, and the things that we find in scope are our audit and maturity models, our digital maturity assessments, implementation support, a maker's lab, which is around innovation labs. Are we able to help? We're able to help you take your ideas and put those into implementation so you can do something with it. We're going to look at your digital strategy planning, which would be your back office, your virtual care, your customer engagement. And then we'll look at things like physical design, where your architecture, interior design, product design, all these type of things roll into what we would call your value realization. We have some great companies that we work with. I'm just going to mention them because I've already had a couple people today who are attending this event say they dropped by the Tech M board here, or the virtual board, and have sent me some notes and asked me that they talk to people about HCI that we're doing. We are part of Tech M. It's a digital transformation organization. Also, we have a lot of lessons we can learn and a lot to pull from. We also, though, things that we can really help you with. We have companies like Tina Farina, who are sister companies and partner companies. They design like no other, we like to say. We have major designers that design cars and Coke machines. It sounds odd, but that's all in the aesthetics and how things look. And Born, we have innovative digital services. Of the top 1,000 companies you look at, a lot of their digital services, of those 1,000, about 25% are on Born type of internet platforms. So very important there. Also Health Next, which is really the top ranked virtual hospital of the future. And you'll hear Ray and Connie talk about that in a few minutes. And of course, MadPow, one of the reasons we're here today, with their usability design for over 10 years, they've been able to design and help organizations make sure that their products are really consumer centric and driven. And I would call it human centered design. So when we talk about all these items, we were able to add the culture, the automation, the application, the infrastructure, the analytics, product design, digital design, virtual care. That all rolls into your strategy. Those are all the things that we can help you design your strategy. So we can go one more slide here, and we look where it says Strategy Next, building your digital transformation strategy in just 12 weeks. That's fact. 12 weeks and $250,000. It's not as much as you might think when you look at some of these huge companies out there. So when we're looking at this, we're going to put things into 4 blocks, and keep in mind there's steps along the way that I'm not going to get into today, but we're going to understand your strategic foundational items like your mission, your vision, your values. We'll hit onto your marketing and assessment items, looking at where your target customer base is, your business transformation, even talk about who your customer is today and why. We'll also hit into your plan design, where we're going to look at KPIs and metrics, look at what's urgent, what's important for you. So we're tailoring what we do to make sure your digital transformation journey is done right. And we're going to look at your growth plan, where you're diversifying, and where you want to expand your continuum. Then we'll finally hit in these operational items. We'll look at balanced scorecards with you. We'll talk communication, and can even maybe get into a little bit of talking about, how much risk you're willing to take on those risk assessment. Maybe even talk a little finance with you down the road. So if we can go to one last slide here, or actually I shouldn't say it, I think it is one last slide here. And questions to ask as a healthcare technology leader. And I'm going to ask these questions here, but also keep in mind, as a healthcare technology leader, you need to look at these things. And that is, where is your digital transformation strategy at this point? If you're having to think about it, you probably don't have one well established. Can digital technology open up new lines of business opportunities? The answer should be yes. Are you aware of what other healthcare systems are doing, and what things are in their digital strategy? Are you looking at things? You understand, are you looking at your automation, your cloud, your consumer, e-commerce, maybe machine learning, mergers, payers, pharmacy related, private equity? Do you understand how all those things blend together? The other thing we look at, where do you consider central to your digital success? Can you answer that question? And then the last question is here, is if you're an IT leader, and we can look at IT leaders and we can talk about, your CDO, your CDIO, your vice president. I mean, you can see this is growing in the titles. And as we know, the more named something is in a language, the more important it's becoming. And we're seeing more and more acronyms, terms, names around digital technology. So my question is, if you were asked today to go supply something to the board, could you do it? And if the answer is no, I think you might want to talk with us, because you got to ask, are you able to align your objectives to the business goals today? Can you be bold when setting your scope? Or are you able to, embrace adaptive design right now? Would you be able to adopt an agile execution on a project you have? And, ask how much disruption could you really create right now with IT in a positive way, that is. So if you're not sure, 12 weeks, 250,000, not millions like you might assume. We're an organization that really, really is passionate about doing this. And we look forward to hearing your questions and any type of items you have for us. And if you go to the very last slide there, you'll see, get in contact. With that said, I'm done. I'm going to hand over to Connie Harmsen and Ray Lowe, the Senior Vice President and CIO of AltaMed, for them to tell their journey of digital transformation and what they've been doing around Health Next.
Very good. Thank you so much, Will. Really appreciated that. And to the audience, know that the slide deck, we will make it available to you after the conference. So thank you again, Will. So this section of our presentation is going to be done in a bit different manner. We're really going to focus on Ray Lowe, who is Senior VP and Chief Information Officer at AltaMed, and we're going to follow an interview format. So I'll be asking Ray questions about his journey at AltaMed and his career in health IT. So I want to first, Ray, and Josen, if you could go on to the next slide, that would be good. And Ray, while she's doing that, if you want to go ahead and introduce yourself, tell us a little bit about yourself, and then we'll get into the questions.
Well, again, so thank you. This should be fun, right? We're going to do this live. So Connie, you may throw me a curveball, so hopefully we'll keep the audience engaged as we have the conversation. So my name is Raymond Lowe. I go by Ray Lowe, and I'm the Senior Vice President and Chief Information Officer here at AltaMed Health Services in Los Angeles, California. We are a federally qualified health center, and we're actually the largest in the country. We provide care to the essential workers, primarily Latino, multi-ethnic, many of them 200% below the poverty level. So a lot of discussions around health equity, health essential workers. How do we close that gap? How do we have consistent delivery of care for these socially disadvantaged populations and making sure they don't get left behind? I've been here for 3 years, just over 3 years, and we actually have done a holistic digital transformation, not only from a technical perspective, data center networks, cybersecurity, but also including our care delivery model to the point, I'll just give you an interesting inflection point. It was April 8th of 2020 when the CEO of AltaMed asked me, Ray, I need to now do video visits. And I'm happy to report that by the end of 2020, we actually had completed over 80,000 video visits that were culturally sensitive and linguistically proper, which means when you're dealing with a population that is not native English speaking, we really need to make sure that the services are delivered in the proper language so that they understand and they can be active participants in their healthcare, so we can all stay more healthy together.
Yeah, excellent, excellent. Yeah, the care that you all provide there at AltaMed, it's within that LA area, very extremely challenging in the work that you have done there. Again, just transformative. So you mentioned a few things that you had changed. Tell us just specifically, when you did arrive 3 years ago, what was the state of IT and digital technology there? Yeah. Where was that fundamental state that you arrived at? Yeah,
so there was quite a bit of technical debt that had to be addressed that Will mentioned in the previous deck around here. It still faults other predecessors that sat in my seat before. AltaMed had explosive growth, and we grew to have over 40 sites. Now we have over 50 sites, and the team was working as fast as they could. But to kind of give you an assessment of where we were when I arrived, is there was no guest wireless. This is 2018, right? There was a lot of opportunities in the cybersecurity perspective in the data center, and we are on a more antiquated EMR system that was probably about 4 or 5 years behind as well. We also looked at other systems such as CRM that needed some uplifting as well, and we also were implementing in some new insurance product lines. So there was a lot of work to be done when I arrived at AltaMed, and it's been a breathtaking pace at which we've been able to do it, but it's for the right outcomes, right, to serve our providers and to serve our patients.
Yeah, absolutely. So if you could, Ray, talk a little bit about the process that you use to bring about what many would describe as transformational change. So you've shared with us the state that you found. So what was your vision? What was your roadmap to be able to achieve that vision? And, doing some of those things would cost some money, which is pretty precious at your organization, as many organizations. How'd you get buy-in for all of those initiatives?
Yeah, so there, I think one important thing is your organization recognized that they needed to modernize, and so they did give me some freedom in terms of budget. It was a set budget that I had to manage within, but the framework that has to be established, and I'm an infrastructure guy as well, is you need to have such a solid technology infrastructure underneath you. And I bet on Cisco, NetApp, and other folks, very tried and true, and had existing relationships that allowed us to really stabilize it. It was a holistic change in terms of what we did around there. And while we're hardening the technology stack, it was time to uplift the applications. So these were kind of going in parallel. And from a technical perspective, I had both on-prem data centers as well as cloud services. We use Epic as our EMR system, and that is being hosted by Epic, and we implemented that in 10 months. When you're doing a rapid deployment, the cloud services likely may be the best opportunity, but when you come back into your home network and your delivery, if you don't have the technology infrastructure built out to support it, it will collapse. When you extend this out and beyond into your patient and out into the public domains and the technology infrastructure in there, it will also collapse, right? So you kind of need to look at what is the approach so that it's seamless both inside of your company for your employees and providers, but also what is going to be needed for the patient on the other end so that the care can be delivered.
Yeah, absolutely. Very, very good. So here you are on this transformational journey. You're there maybe 18, 20 months and doing a lot of significant change. And then COVID hits with its massive impact on our world. And you and your organization were able to really ramp up to meet the community needs. And you mentioned the telehealth and doing it in culturally sensitive manner, which 80,000 visits as we understand it. You also did something pretty interesting in regarding to setting up some COVID-19 test sites for the community. So just wondering, how did you, with the delivery team go about doing that? What was the impact on the AltaMed community?
Yeah, so it's interesting. March 10th. That's the date, right? That the pandemic was actually called, and many of us were watching what was happening in there, what was happening out of Wuhan. There was a big HIMSS event coming up, and we were thinking of going out there to see what the new healthcare innovations would be looking like. AltaMed was no different than any other healthcare system. When the pandemic hit, people were afraid. They're afraid for their lives, they're afraid for their health, and they avoided care. So we went from having very busy clinic volumes to having nobody show up. And we had to pivot. We were a very in-person company to being a virtual company, as many other folks have done as well. But when you're looking at the technical debt and the transformation around there, fortunately, putting the right building blocks in place to stabilize the environment, we had to accelerate a couple of key areas that we were able to, with the tremendous partner support from AT&T and Cisco and Presidio, that allowed us to obtain parts, products, circuits in a much quicker space, which allowed us to go virtual and push our workers virtual. But then from a clinical delivery perspective, again, the partnership that we had with Epic, and we set up 11 COVID-19 drive-through clinics. Again, let's think about April of last year, right? I mean, you couldn't get one of the lines. For me, a reference point would be Dodger Stadium. I mean, everybody saw it on the news, right? Just snake lines of cars extending forever to be tested. And what was the outcome? We stood up 11 of those. One of them was provided to us by the city of Los Angeles on an empty lot in the Boyle Heights area, which is a socially economically challenged area with absolutely no services. So from a technical perspective, it's how are you going to solve that, right? There's no power, there's no internet, there's not a plug to do this, right? And we were able to transform this lot with some help from AT&T, thank you to AT&T, to provide over 250 tests in the community to address what had to happen. So we're very proud that we're able to help the community, be in the community, and provide this valuable service. Often I think healthcare kind of happens at home, right? So if you're there and you're in the community will trust you, versus kind of going into institution, which is something that we pride ourselves on here at AltaMed.
Yeah, that's tremendous story, Ray. Really well done. And I think I would say that, your early comment that you went in and you weren't just wanting to do IT change, you were wanting to do delivery change, and you did it all together, bonding with your team and those other leaders and bringing it about. That then was exemplified with what you were able to do for your community when the COVID pandemic hit. So I know another pretty current and innovative project that you have going there at AltaMed is remote patient monitoring.
Right.
You're doing a pilot for your congestive heart failure patients. And so I wonder if you could just tell us a bit about the pilot, your expectations for that, and really what most excites you about that project.
Sure. Let me give a little more context around this. So when we're talking about patient-centric care, and that's being digitally enabled, like televisits is a hot topic. It will be here to stay, whether it's televisit or telephonic, similar to our meetings here around there. But as we're looking at what the consumerism of medicine is, and the expectation, and we're dealing with chronic disease states, is how do we keep the patients healthier? How do we avoid the admissions, right? They go to the hospital, when they need to, not to be observed. So as part of this clinical digital transformation, right, is setting up the tele aspects was absolutely important. I'll just tell you, a year ago, April 10th of 2020, the CEO came to me and said, Ray, I need tele-video visits. Like, wow. And you kind of like the numbers out there, and we did it, and we did provide it, integrated, and culturally competent. But we knew our road was not done. The next phase of it is how do we now deliver more care to the home? How do we engage some of our sickest patients so that we can monitor them virtually, right? And to be alerted so that if an intervention is required, we can call them, we can send somebody out there. So, and that's enabled through remote patient monitoring. And we actually are using Health Next and the tools around there. We have a pilot group, a clinical pilot group. I don't want to diminish that, right? Of about 20 folks on congestive heart failure, where we are managing respiration, pulse, weight, et cetera. And there's a variability, right? The virtual care team is alerted, and they're allowed to take the intervention. When you think about how that kind of changes your care or the care of a loved one, where the care delivery network is reaching out to you and saying, hey, listen, we're seeing that you have a 5-pound weight gain. And again, with congestive heart failure, right, weight gain is one of those areas. You can see like 3 to 5 pounds in a couple of days is significant, right? It's pulmonary, it's water, it's and it needs to be addressed. So from a patient perspective, you know, they have more security, right, that they're being monitored. From a provider perspective, you're actually receiving real-time alerts that let you know where to intervene, right? And so the net outcome, you know, is improved quality of care, you know, for folks. Whereas somebody say, I'm not going to deal with it, you know, I feel fine, so on and so forth, and it's not terribly invasive, you know, for the patients. It's, you know, people on a pulse oximeter getting on a weight scale. It's all Bluetooth enabled around there, and then it transmits back. And they're nice little data sheets where we can see the trend analysis and where the alerts are, and they're alerted to the patients. You know, we're still working through some of the areas. You know, I think the goal should be about 20 to 30% of alerts need to be addressed, and you know, there are learning opportunities with patients, like what is this newfangled device, what am I supposed to be doing? So there's some patient education that we always strive to make sure people are aware of how they're doing it. And then from an innovation perspective, you know, how is your virtual care team and your nursing teams going to be addressing and, you know, to solve these type of alerts? So we're very excited about RPM. We think that, you know, RPM is kind of a gateway to a potential at-home, kind of like nursing home and other type of opportunities. Many of the type of areas people are looking at are CHF, COPD. We can look at either journeys on asthma or other areas, diabetic controls, and all this can be monitored remotely with a virtual care team on the other side.
Yeah. Terrific. Thank you, Ray. That was really, again, seeing how I'm really impressed with how integrated you are with your delivery team and focusing in on that patient care, using these digital technologies to really bring about improved care and satisfaction and happiness for these patients getting to stay at home and be cared for. So you've got so many transformative projects that are going on at AltaMed, and just congratulations for that. I'd like to, in the time that we have left, to just shift our focus a little bit more towards you personally, Ray, and your leadership style. And you've done a remarkable job in being not only a technology leader, but a healthcare leader. You know, there's a new term that's being used to describe the role of the CIO, the proxy COO. So what does that term really mean to you? And, you know, when you look back on your career, what roles and experiences really helped and fostered your leadership skills? So let's start there with those questions.
Well, thank you for your kind words, Connie. I think you subscribe to Becker's Healthcare, where I think there was an article that was written about the COO by proxy to the COO, right? COO by proxy, right? You know, CIOs, you know, historically, some of them may have been more back office, kind of taking care of the systems, taking care of the data center. And the value, really the value realization, people say seat at the table. The way you get a seat at the table is you really need to understand the business and the delivery and the outcomes around there. So CIOs understand the systems that are in place and their opportunities, and where we can enhance or where we need to move forward. So as we described earlier around the digital transformation work, again, this has all been done in a year, and there are plans you could follow, right? But you need to have very good strategy, and you need to be educated. And education can be from vendors, it can be from conferences like these, et cetera. But a roadmap really needs to be defined. And as we're vetting through clinical solutions, it's including your physician-led analysis or your provider-led analysis. So the benefits and outcomes are clearly understood as to why we need to keep moving ahead. And what that really is talking about, Connie, is innovation, right? And innovation can be scary. Innovation can be hard. But if you don't try to change, we will never change. And on the innovation front, it's important as well. If you fail, you have to fail fast. And people have said that. And creating a safe environment that, well, okay, we maybe didn't make the right decision here, but we did learn something. Because there's always learnings in any type of opportunity that that we are presented with, or a problem to solve. So with an understanding of what your current capacity is, that's really a baseline. Understanding the innovation really kind of gives you a vision of where it could be. And you can talk about the gap, and that's how you kind of get that COO role by proxy, and you end up leading the business and talking about what the outcome can be, right? And then we need to really focus on kind of on the workflow, the change management, and those aspects to just deliver superb delivery.
Yeah, really, really good. So I'm going to ask you a bit of a surprise question, Ray. So, again, I have had the pleasure of being able to work with you on the CHF pilot, and just amazed with what you and your team do. How would your teammates describe working with you?
They would say that I'm very strategic, I'm thoughtful, and that I'm supportive.
It's very, very good. And so when you take and look at those things, I wonder about mentors and being a mentor to others. Has that happened for you along your journey? Have you had a mentor, and have you mentored others? Because I think that anybody that would get to have that opportunity to be mentored by you would be a fortunate one. But just wondering your experience.
Yeah, Connie, I think that's so important. Those of us that have been around the track a few times, we really need to help. We all stand on the shoulders of other folks ahead of us that have learned it or blaze a cow path around there. Going through the jungle and hacking through it with a machete is an approach, right? But I think we all owe each other to teach and learn. I mean, I don't know anything. I never will know everything. And there are so many new developments that are constantly happening, and you have to keep learning. But folks that need to be mentored, I do mentor some folks, is what about this? How are you thinking about that? And, oftentimes as people are considering options, it's a gift to present a context. What's the context of what you're thinking about? What's the outcome you want to think about? Take a step back further. What are we really trying to achieve? Because folks are often very focused on solving an immediate problem, which would do something, but have we really changed the paradigm? So I kind of like to take an approach of, what is the outcome? What is the benefit of what we need to do? And that also helps to find prioritization. The other part on kind of mentoring is I've had a very interesting journey in my career around there. I've been blessed to work for a lot of fantastic healthcare organizations as well. And they all have different personalities. Fortunately, we all have the same mission about improving healthcare and health equity for everybody out there and delivering quality. But we can all definitely learn from each other, and we have to help each other.
It's wonderful. Very, very good. So in hearing all of that, there's so much still ahead for AltaMed. And I'm wondering about you, Ray. What's next when you think about you and your professional career and the things that you want to continue to do at AltaMed, and probably potentially even on a global basis. But what is next for Ray Lowe?
Yeah, well, thank you, Connie. Again, thank you for your kind words and your high praise. The work that we've done really in the last 18 months, it's not even 3 years, it's really 18 months in terms of really focusing in on health equity and serving the Medicaid, Medi-Cal population, which is often left behind. Now, granted, we're in a rural urban setting, very dense, but the same problems apply to rural environments where there is a dearth or there is a healthcare desert around there. So, my goal really is that we should like to be, it's a big ambitious goal, is we really want to be the model of care for Medicaid, and to really prove, right, that the folks that maybe lower income, that they should not be socially disadvantaged by their zip codes. And or from a language barrier or from cultural sensitivity. And And I'm just so honored that I work for an organization that's at our core, and we continue to have that mission. To scale that out is just a dream. I think it's achievable. It takes strong voices. It takes one voice to speak up, and we can change the world. So that's what I'm thinking.
Oh, my goodness. I just want to give you tremendous applause, Ray, for what you have shared with us. And again, what is happening at your organization. I love the fact that you're wanting to do this and show the world what can be done for a Medicaid population in all the beautiful manner that you described. Really, thank you. Thank you very, very much. We're going to now shift back to Will, and actually to our audience, because we have about 5 minutes left in our presentation. And we're wondering if there are any audience questions that you might have for Ray, Will, or myself. Sounds like this is a lunch and learn, so people are probably enjoying their sandwiches. So, you know what, please, we're happy to hear any, and you can put them into the chat box if you want. But we did also, we had a question that we thought we would ask each other while we waited to see. Oh, very good. Here is someone from Anna Bach. Ray, who's providing the technical equipment for your CHF pilot?
I'll tell you, we actually started with HCI. We have a long relationship with HCI. As part of our Epic Go Live, we did utilize their services for elbow-to-elbow support. And when you talk about innovation and taking risk, the best people to take risk with is with established partners that you have around there. And so we engage with Ed Marks and Connie and Will, and we were uncertain. I wasn't quite sure how to move ahead on this around there. And so we are actually leveraging Health Next, which is a partner with, Vitotech, which is a partner with Health Next in terms of the delivery of the tool. And we've been doing our pilot for about 4 months, right? So we're seeing good progress, but it's a great question.
Yeah. Thank you, Anna. Very, very good. Any other questions from the audience? Well, while they're thinking, we did have a question that we thought we might ask each other. And it's really thank you, audience. Your questions are better than ours. So this is from Ronita Burns. What's been the biggest difficulty in putting this together and the biggest surprising lessons learned, good, bad, or neutral? I think that's another one for you, Ray.
Yes. Well, the pandemic, basically you did a marathon in a 100-meter run is kind of the biggest surprise. So much innovation happened in the last year. And there's a quote by Warren Buffett, who's swimming naked when the tide goes out. And a lot of folks, were less clothed than they wanted to be around there. So I think one of the biggest lessons learned, right, is you cannot ignore your technical debt, because it will catch up to you. And when something like what we are all going through now happens, it's very unfortunate, right? And it needs to be remediated. I think the other part, what gives me joy, is just the adoption of our communities. It's people kind of go, the essential workers, Latinos. I mean, you're hearing about the folks that are working in the poultry plants, or in food service, not in the markets, right, but in the produce in those areas, and those are our patients, right, and they don't have the ability to go to another room for 2 weeks, right, to wait it out, and they have to go to work, and it's either go to work or don't have any money, and so they have these real life and death situations where some of the stimulus opportunities don't reach them because they could be undocumented. or they could be DACA, right? And the fact that we've been able to, deliver this transformational change. If you asked me 3 years ago, would this have happened? I would have not even foreseen this, right? And so the ability to prove that you can do something by leading strong and, having good conversations and sharing a vision of the future and listening to your business partners, listening to your community, but not losing focus on what the outcome of what we have to deliver is just wonderful, because there are lots of times it could have been pulled off, right? You need to have that relentless focus of what we need to achieve and sprinkle it in, right, with specific and actionable items to make this appropriate for who we're working with.
That's beautifully said, Ray. And I thank the audience for the questions that you've shared with us. It's just been a wonderful hour that we've had the opportunity to spend together and to hear so much from you, Ray, and what you're doing there. You and your team at AltaMed, thank you for that and what you're putting into our world. Will, thank you for the tremendous digital strategy that we can get this done in 12 weeks if we want. That'd be just great for so many of our organizations. So again, thank you all. Best wishes to everyone. And thank you, HXD, for a great conference. Thank you, Josen, for all your help. Bye-bye.
Bye-bye.